So stem cell transplant continues to be a very important option for patients with myelofibrosis. I think earlier types of MPNs, it's still, the risk with transplant, I think, still really exceeds its utility. So it's really a therapy for MF. Big lessons that we've learned over these 10 years with JAK inhibitors. One, we can transplant people too late. So people that are younger, good candidates, higher risk, we definitely need to consider it. People probably benefit when they're having an optimal JAK inhibitor response. Transplant as a salvage therapy for a patient that really is declining or progressing is probably less efficacious, greater risk of relapse, and less likelihood of success. It is an incredibly complicated personal decision as to whether to pursue a stem cell transplant. So what I do in my management of patients, I try to have them visit with a stem cell transplanter early on if they're a potential candidate now or in the future. And for us to kind of always keep that in mind, is that something we should do now? Is that something we should do after a period of time? Is that something we should only do if the disease progresses?